Hello. Today I would like to do a little video about implant surgery and what kind of implant brands we use, mostly on the clinic. The most common implant brand is Straumann. Straumann is the largest brand in the world, actually, implant company, and they are producing very good implants, very simple to use as a surgeon and also very simple to use as a prosthodontics. The procedure is very simple. We start with a marking burr. Looks like this, or a round burr. It's up to the surgeon to decide what they want to use. After that, there is a very simple procedure you follow. We have burr for 3 different sizes of diameter for the implants. Yellow is for 3.3, red is for 4.1, and green is for 4.8 in diameter of the implants. And on this plate we also have burr for conical implants. These burr are also conical in shape. When we start with marking burr, and it's up to the surgeon to use what they wants to use, a round burr or a marking burr like this one in shape. I prefer this because it's very sharp and I like it very much. The next is to go to blue. It's 2.2 millimeter and you are drilling to the deep you want to have, and on the burr there is markings, so you can see what deep you have when you are drilling. And the next step is to go to the yellow and do the same with this. And red or green, dependent on what diameter you want to put in. And if there is in the lower jaw, in the mandible, I always use a widener. It looks like this. It's a widener for the cortical bone, so the implants will come in place much easier and to prevent heating. And I also use a countersink. It looks like this. A countersink. It's perfect to use before. I use it always in the lower jaw. But if it's soft bone in the upper jaw, in the maxilla, I sometimes don't use it. On the bridge, there is also marking pins, so you can see what deep you have and also what direction you have when you drill. And they are also in different diameters, as you can see here. We have 2 different screwdrivers. They are exactly the same, but one shorter and one longer. All screws and the cover screws, healing abutments for Straumann is exactly the same. So we just need one screwdriver for everything we do. And we also have this device in different lengths. This is actually the device we use when we are placing the implants in the seat. This we also have for another device, so we can do it for hand if we want to do it. The most important thing when we are drilling are to prevent heating from affect the bone. So we change burr quite often, and there is different systems you can use to know how many times you have used the burr, but we do it very simple. When we are packaged, we have a tape on this and marking for how many time we have used the burr. In this time is 4 times. We use every burr up to not more than 10 times. Because there is a big risk for failure because of heating. When we decide what's the best for the patient to use implants or doing a bridge instead, depends on actually how the tooth in the mouth looks. If they are in good shape without fillings, there is of course the best to use an implant, so we don't have to affect very good tooth. And if there is many fillings in the tooth close to the gap, we can consider to use a bridge instead, because a bridge is actually very good and very solid, and the aesthetic things is absolutely perfect also with a bridge. So it depends on the patient and the situation when we use implants or we use conventional prosthodontics actually. If you have any questions, you can send the questions to my mail, and I will of course answer you as fast as I can, and have a good day.